Good evening, everyone. Thank you for waiting and thank you for joining us today. My name is Minhee Park and I will be your MC tonight. 안녕하세요. 한 캐나다 오픈 세미나에 참석해주신 모든 분들 진심으로 환영합니다. 저는 오늘 행사의 사회자 박민희입니다. 반갑습니다. The Korean Consulate in Toronto has organized an open seminar series in collaboration with the Korean Canadian University Professors Forum to promote cooperation in various fields for the post-COVID era. Before we start the seminar, there will be Consul General's welcome and opening remarks. 주 토론토 총영사관은 포스트 코로나 시대에 다양한 분야의 협력을 활성화하기 위해 캐나다 한인 교수협의회와 공동으로 한 캐나다 오픈 세미나 시리즈를 진행하고 있습니다. 오늘 강연 소개에 앞서 먼저 김득환 총영사님의 환영 인사가 있겠습니다.
Good evening, everyone. I would like to welcome everyone to the 2022 First Korea-Canada Open Seminar. My consulate organized this seminar series in collaboration with the Korean-Canadian University Professors Forum. We are pleased to have a keynote speaker, Professor Jae-Hoon Lee, here to discuss the impact on mental health and preparation in the post-pandemic period. Today's topic is a very important one. As you know, the COVID-19 pandemic brought huge changes to how we live our lives, and with it uncertainties, altered daily routines, economic hardships, and social isolation. While the threat of virus has been brought under control and restrictions eased, 2 years of pandemic-related stress, grief, isolation, and trauma has led to an echo pandemic of depression and anxiety that we now need to focus our attention on. Therefore, I think it is important to consider how to support those who are at a greater risk of experiencing mental health difficulties, and also how to empower people towards great community engagement to preserve the vitality, strength, and diversity of our communities. I believe exchange and cooperation among individuals, health professionals, community organizations, and governments is crucial for dealing with the post-pandemic mental health impacts, and I am confident we can work together to facilitate regional cooperation to respond to new challenges that emerge in this post-pandemic era. Once again, I would like to express my sincere gratitude to Professor Lee for facilitating this important discussion. I hope you enjoy today's seminar, and I wish you all good health. Thank you.
Thank you, Consul General. 감사합니다, 총영사님. It's my pleasure to welcome today's guest speaker, Jae-Hoon Lee. He is an assistant professor in the Department of Psychiatry, Division of General Adult Psychiatry at Western University, London, Ontario, and a physician of General Adult Ambulatory Mental Health Service at Victoria Hospital. His research interests involve epidemiology, psychopharmacology, neurostimulation treatment, digital therapeutics, and cultural psychiatry. 오늘 세미나 연사이신 이재헌 교수님은 런던 온타리오의 웨스턴 유니버시티 슐렉 이과대학 정신건강의학과 조교수이시며 런던 헬스 사이언스 센터 빅토리아 병원 정신의학과 전문의이십니다. 이재헌 교수님의 주요 연구 및 활동 분야는 사회 불안장애 및 공황장애에 대한 한국형 치료 지침 개발을 포함하여 기분장애, 불안장애, 외상후 스트레스 장애, 직무 스트레스 등이 있습니다. Today, Professor Lee will be sharing his expertise on the theme of impact on mental health, and preparation in the post-pandemic period. We hope that this will be informative session to learn impact of the pandemic on communities and mental health, and how to increase preparation for mental health challenges. There will be Q&A session afterwards, so if you have any questions about today's topic, please leave your question using the chat function. Please welcome Professor Lee. 오늘 이재현 교수님께서 코비드-19 팬데믹 이후의 정신건강 문제 및 대처 방안을 주제로 강연하십니다. 오늘 강연을 통해 코로나가 지역사회 및 정신건강에 미치는 영향과 어떻게 하면 효율적으로 이 문제들을 코로나 시대에 해결 및 대처할 수 있는지를 배우는 유익한 시간이 되기를 바랍니다. 강연 후에 질의응답 시간이 마련되어 있으니 오늘 강연에 관해 질문이 있으신 분은 채팅창을 활용하여 질문을 남겨주시기 바랍니다. 자, 그럼 이재영 교수님을 모시겠습니다.
Thank you so much for your kind introduction. It's very honor for me to present my topic in this great seminar series, Korea Canada Open Seminar Series. My name is Jae-hyun Lee. I'm a psychiatrist in Victoria Hospital, London, Ontario. And I'm an assistant professor at the Department of Psychiatry in Western University. Before starting my presentation, I just wanted to talk about my language limitation. I just joined the hospital 10 months ago from South Korea. English is not my first language, so I have different accent. Sometimes my grammar, pronunciation, accent are not accurate, so please understand me. But if you have any problem or if something are not clear, please ask questions for me at the end of the session. I will be more than happy to answer all of your questions today. Okay, I'm going to talk about I'm a psychiatrist, so I'm going to talk about the COVID-19 and its negative impact on our mental health. And more than anything else, we have to prepare for the post-pandemic period, because we know that we suffer from so many mental issues by ourselves. Yes, I also had big difficulties, big challenges before starting my work in Western University. To be honest, my first day of work in Western University was in November 2020, but I just started my work last summer because due to the COVID-19, my visa was delayed, so I was not able to start my work. So last year, at the first 6 months of year 2021, I did nothing in South Korea. So it was so hard. And my family was in Toronto. I was not able to visit them for 1.5 years. Yeah, so it was really, really hard. I believe everybody was very had difficult times during COVID pandemic. And as a physician, as a psychiatrist in the hospital, every day I see my patients, Canadian patients, sometimes I see Korean patients, but I felt very sad because due to COVID-19, many people got very serious illness, even for patients without any previous psychiatric disease. Yeah, so it is a huge negative impact on our mental health. So this is a picture of the hospital lobby that I took a picture when I started my work. I was very frustrated because there were no people, no patients. When at the first day of my work, I just saw my patients virtually, and I couldn't see my colleagues, faculty members in the hospital, not in person, just but virtually. And for now, some faculty members could not be seen in person because every seminar, every department meeting, committee meeting were held virtually. Yeah, so it was a very frustrating situation. This is the waiting room in my department division, outpatient clinic. There are no patients. Nowadays, a few patients are being seen by in person in the office, but we still have some limitations to see patients in person like this. So, excuse me. So, what is an infectious disease? We know that everybody know that infectious disease develop from infection by such as bacteria or virus. Some virus or some bacteria has very rapidly transmission property. So this COVID-19 caused us to be locked down, to be isolated. Like COVID-19 patients with highly infectious disease causing great social impact are to be, definitely will be quarantined, followed by appropriate pandemic response measures taken. So what did COVID-19 pandemic impact on our mental health? We know that COVID-19 pandemic has posed a serious threat to everybody globally, internationally. There is a varying yet considerable increase in mental health issues such as anxiety, depression, trauma, adjustment issue, insomnia, substance use abuse, so many mental issues among the general population, and even for vulnerable groups such as child, adolescents, elderly, and patients with medical illness such as cancer patients, something like that. The aftermath is obscure and speculative from a social, economic, individual, and public mental health perspective. Huge negative impact on mental health. So many papers, many scientific data were published. So recent published studies, scientific data support that the existence of emotional epidemic curve describing a high probability of an increase in the burden of mental health issues in the post-pandemic era. I will talk about more the reason why we have to be concerned. We have to prepare for the post-pandemic era. Furthermore, previous major public health emergencies we experienced, as far as I know, Canada locked down very strictly the people. Previous major public health emergencies showed that more than half of the population developed mental health problems and required mental health intervention, such as adjustment disorder, bipolar, anxiety, depression. So there is an urgent need to address the current unmet needs for mental health and to prepare for future challenges in the post-pandemic era. What were the pandemic stressors? Exposure. So fear of being exposed to COVID-19 virus. And we had also a fear of being infected by COVID-19. Our movement was strictly restricted by the government, and we also suffered from economic hardship, sufferings. Some people were stigmatized and some people were discriminated, and we saw many people were very violent, and some people were very neglected, and some people lost their job. Many stressors were there. So this is a paper. This is scientific data published by Dr. Roger McIntyre. He is one of my colleagues in Toronto, very renowned psychiatrist. So he published a paper that he analyzed the statistical data from about the rate of unemployment from the previous years, and they predicted the suicide rate after COVID-19. They reported that due to the COVID-19, suicidal rate would be very, very highly increased. So it is very, very difficult situation. and suicidal rate was related to the rate of unemployment. So suicide prevention in the context of COVID-19 related unemployment is a critical priority. Furthermore, timely access to mental health care, financial provisions, and social labor support program, as well as optimal treatment for mental disorder is very urgently needed. Okay, let's move to stress during infectious disease. We suffered from, I would say it was really agony for us. So from the infectious disease, which stresses are there? This is a very common reaction after the serious infectious disease. Anxiety and fear and obsessions with information search for outbreak of infectious disease are very, very popular. The feeling of awareness, this is very serious situation because we, as a human being, interpersonal relationship is very, very important for our mental health. But a feeling of awareness about other people are enhanced with increasing suspicion. Outdoor activities are decreased and become helpless. So as such, so we experience very negative mental health outcomes: distress, anxiety, depression, trauma, substance use, smoking cigarette, drinking alcohol, using cannabis, sometimes illegal drugs such as cocaine, something like that. And we were burned out, especially mental health, healthcare providers were burned out. And more than anything else, I'm interested in people who have pre-existing mental health illness. So these are negative mental health outcomes. As such, in the post-pandemic period, memories related to pandemic remained, and economic hardship continued longer than the pandemic itself in many cases. So that is the reason why we should prepare for the post-pandemic period. Guilty, powerlessness, and grief among the survivors who had lost their intimate people may lower the overall morale of society. Patients who overcome serious COVID symptoms may experience flashbacks and become mentally and physically disabled. Working capability may decrease because of fears over the after effects of a sickness, not just the physical complications, but also persistent anxiety about the possible long-term effects of virus. So we have to deal with the stress. This kind of stress, this kind of difficulties. So I'm strongly encourage you to read this guidebook. This is published by World Health Organization. It's very, very helpful illustrated guide. The title is Doing What Matters in Times of Stress. A few months ago, it was published. You can visit this website, and you can download the book, guidebook, without any restriction. It was translated into many different languages, including Korean, French, Japanese, Chinese, many different languages. So what is a stress? We are now talking about stress. When we have stress, we are easily to be very angry. We can sit still, restlessness. We may have sleep difficulty, insomnia. Sometimes, so many patients who suffer from COVID-19 complain of brain fog, concentration difficulties. It is related to COVID-19 stress. And we may feel sad or guilty, worry, keeping crying, feel very tired without any reason, any without any medical reason, and changing in our appetite, increasing or decreasing appetite are very, very common, our physical reaction to stress. Many of us think a lot about bad things from the past or bad things we fear in the future. Yeah. So in this slide, what I want to say is our thinking very negatively, negative thinking style. So yes, these are a very common reaction to stress. Everybody can experience these types of stress reaction, but problems can be serious. I mean, but problems can be serious when we were occupied with these type of thought and feeling, very ruminating thought. Yeah. So it is called as hooked. So what does hooked mean? Yeah. So when we encounter stress, our thought can be very negative, and so we cannot get out of the negative thought. So we can be hooked by the negative thought. This is very common, but if somebody have persistent this type of occupied thinking, so we can call it as hooked, yeah, by the negative thinking. That would be very, very problematic because we would be very occupied with negative thinking persistently. Yeah, it can cause depression, anxiety, very serious illness. So what does hooked mean? When something is on a hook, it can, yeah, definitely it cannot get away. The hook traps it. And the same way, in our mind, we can get hooked by our difficult thought and feeling. Yeah, so one moment you might be playing with children, but you might be hooked by difficult thought and feeling just after the moment. Yeah, the next moment you might be, so our mind can be very shifted very quickly. Yeah, this is the status being hooked by the negative thought. So, yeah, so you may have some very pleasant time with your family members during dinner, but in the next moment, you might be hooked by angry thought and feeling. You may feel as if you're being pulled away by anger, even if you're still there. Yeah. So this is very common, a very popular stress reaction. So what I want to say is, when we encounter a very serious, overwhelmed stress, so our thought can be occupied by very negative thought. It is very common, but if somebody have the persistent negative feeling, it would be very, very serious and very, very dangerous, yeah, in terms of mental health issue. Yeah. So in stressful situation, difficult thought, mainly I think a negative thought, and feelings, negative feelings, sad, worry, anxiety, something like that. Difficult thought and feelings hook us, and we are pulled away from our values. Okay, so what does value mean? Yeah. Okay, so we were hooked by the negative thought, and we were trapped, and we were frozen, and we can not think freely. We cannot think positively. So from the situation, so we are pulled away from our values. What does value mean? Value describes the sort of person you want to be, how you want to treat yourself and others and the world around you. So when your negative thought occupied you, you will lose your value. So it may cause depression, anxiety, many mental issues. Yeah, because we lost our values. So we, as a human being, so we cannot live without value or meaning in life, in our lives. So value could be similar to the concept of meaning. I like the concept of meaning by Dr. Viktor Frankl. He is a very renowned psychiatrist. I believe some of you may read The Man's Search for Meaning. This is very popular, renowned book. I strongly encourage you to read this book. There is a very good Korean translated into Korean book. Yeah. So meaning. So having a sense that one's life has meaning. This means the conviction that one is fulfilling a unique role and purpose in a life that is a gift. In other words, a life that comes with a responsibility to live to one's full potential as a human being. So when we encounter very overwhelmed stress, some of us may lose value or meaning. I want to say that losing value or meaning could be the one of main cause for us to be still anxious and depressive even after the pandemic period, in post-pandemic period. So when we get hooked, our behavior changes because we lost the value or meaning. We often start doing things that make our lives worse. Yeah, so we call these behaviors away moves because when we act this way, we are moving away from our values. So it is good to know it is good for you to know that if you could not overcome overwhelming stress, you might be occupied by negative thought and hooked by negative thought, and you will be in a status of meaninglessness or the valuelessness. Yeah. So this is very serious situation. So how can we deal with this meaningless status and valueless status? Yeah, this is the key that I want to say today to you. Mental health handling during post-pandemic period. Yeah, so emotional storm. Yeah, so I have seen many patients who have emotional storm even after being recovered by COVID-19 physically, because they were occupied by negative thinking, worry, anxiety. So how can deal with this emotional storm? Yeah, very negative status, mental status. I could say this status is called as free-floating anxiety. That when you are trapped by negative thought, so your anxiety is not grounded. I mean, your anxiety is very free-floating. Yes, you cannot concentrate on something. You're very restlessness, and you cannot initiate something, you can plan something to do something new. Yeah. So emotional storm, so your status will be very similar to the situation you are in high in a tree when a storm begins. In that situation, would you want to stay in the tree? No, I don't think so. So while you are in the tree, you're in a great danger. So you have to be grounded. So what is the benefit of being grounded? Underground, you can help others. For example, you could comfort others while the storm rages. And if there is somewhere safe for you to hide, you can only get there after you are underground. You should be grounded, because if you're high in the tree, you will be more and more dangerous. Let me summarize the talking that I said to you until now. There were big negative impacts on mental health issue due to COVID-19, and there are common reactions. There are common reactions to the COVID overwhelming stressors such as COVID-19, and the common reaction was very negative thinking, and the status that we are hooked by the negative thinking very persistently, and it is called as like the situation where which you are in a very high tree, and so we have to be grounded from the tree high, because it will be very dangerous. So I want you to practice this exercise to be grounded, because so the anxiety is usually very free-floating. Anxiety, it does not have any reality. So so we are very anxious, but in many situations we don't know the reason why we are anxious. Yes, that is a status we are very in a high, the free-floating anxiety status. So we have to be grounded, especially in this unusual times. We have to be grounded, and I want to teach you about the grounded technique. Yeah, this is very helpful, and this is very this has very scientific data. This is very helpful techniques for the general population, even for patients with mental illness and medical disease. So you can start with a deep breathing, and you can concentrate on the breathing, your breathing, and slowly press your feet into the floor, and slow like a figure, and slowly stretch out your arms, or slow press your hands together. And then you can refocus on the world around you. Notice where you are. So you are on the ground. You are not in the tree. Notice where you are. So to notice, to be aware of where you are, you can try to hear something around you. You can smell something around you, and you can try to know where you are and what are you doing. Yeah, this is basic grounding technique. Yeah. So when you feel anxious, it is a very good strategy to cope with free-floating anxiety, grounded technique, because we have to find our value, because we lost our value, we lost our meaning due to high anxiety, depression. As I said to you, value is what I want to be, what I want to treat others. But due to the anxiety, due to the free-floating anxiety, negative thought, because we were hooked by negative thought, we lost our value, our meaning. So we have to return to our meaning. To do that, to facilitate doing that, returning to our value, meaning, grounded technique is so useful technique for us to do every day. This is not difficult. Just start with a deep breathing, like a meditation, concentration, your breathing, and then I will show again. Press your feet into the floor and slowly stretch your arms and slowly press your hands together. And then please try to be aware of what the others, what the situation around you are. So please try to do this every day. Grounding technique does not make your emotional storm disappear. It just keeps you safe because the pandemic will disappear finally. Okay? So we cannot control the pandemic because we lost our control power. So that was the reason for us to feel depressive mood. So one of the popular theory for depression is so because we lost our power, because we lost our control, so we got to be depressive. So it is important for us to know that we cannot control post-pandemic period, but we cannot control our anxiety. We can be grounded with the reality. We can encounter the reality without any free-floating anxiety, not being hooked by the negative thought. So the purpose of the unhooking and grounding exercise is to help you engage in real life, not anticipatory, very unclear life. So this is the kind of coping strategies for us to learn to engage in our real life, to find the meaning and values. So I talked about the grounded technique for you to find a meaning or value, and I will talk more some other tips to be grounded more. I will talk 7 or 8 tips for you to find to be more grounded. So the first one is to please pay attention to reliable information. So pay attention to information provided by the Canadian government or a reliable institute. Follow the recommendations, including health check, medical checkup, and correct information increased during pandemic period. So it will lead to making wrong decisions. So please pay attention to reliable information for you to find the value and meaning and to be grounded. Second one is emotional suffering is a normal reaction everyone may experience. Everybody as a human being, we suffer. As I said to you, I also had very severe adjustment problem. I still struggling with being adjusted to Canadian workplace, Canadian hospital. I have never, so it was really suffering. I have never worked outside of South Korea, and so it is my first workplace outside South Korea. Unfortunately, the medical license in South Korea, my medical license is not exchangeable between Korea and Canada. So I had to overcome many barriers to be able to work here. So emotional suffering is a normal reaction everyone may experience. So please generalize your anxiety and depression, loneliness, insomnia, and some physical symptoms, mental symptoms. But if you suffer severe or serious, significant mental health issue, please try to practice grounding technique, or please consult mental health professionals. Stay connected with family, friends, and colleagues. Loneliness is the number one risk factor for depression in the world. So stay connected with family, friends, and colleagues via phone, video conference, and email, anything that you can do. a little regular life, routine life is very, very important. It is important to go to bed and get up at consistent times to keep your mental health. So this is very good research data recently published in US. What intensity is optimal for exercise? Everybody know that exercise is very powerful for overcoming anxiety, depression, and mental health issue. But how much time? Yeah, according to the scientific data, only even 2.5 hours, only 2 hours, 3 hours per week of physical activity, moderate intensity aerobic exercise will be enough, according to the scientific data. So please do exercise, please do increase your physical activity, but even for 3 hours, 2 hours, it will be enough, according to the scientific data. And please find the pleasant activities, so hobby and exercise, any clubs, joining at the club, hobby club, it will be very, very important, because physical activation is very highly recommended treatment method for depression. Okay, so this is the research that I did in South Korea, and 2 months ago, the paper was published. So I tried to let people with high stress exercise outside. So from the result, outside exercise is much better than inside exercise. So please go outside to do exercise outside. Have a sense of pride. Quarantine was the most important activity. So you don't have to fear stigma or negative awareness. Government and fellow citizens would deeply appreciate you enduring the quarantine. Return to your normal life with confidence after end of quarantine. Please have a sense of pride, and please pay special attention to vulnerable populations such as children and youth, and help quarantine patients and their families overcome anxiety and stress. Being kind to others, that is the very efficient way to find meaning and values. Being kind to others. Support professional healthcare providers, frontline workers in medical field, support them. It will be very good for you to feel meaningfulness. So acting on your values, you should not be hooked by negative thought. To avoid this, the grounding technique would be a good option for you. And being kind to others and yourself, and making room, because finally the COVID pandemic, COVID-19, will disappear. We know that, So really hope we will be able to see this type of rainbow again soon without any concern about COVID-19. Let me summarize my presentation today. I want to stress on the practice of grounding technique to find the meaning and value, and please follow the tips. Stay connected with people, pay attention to the correct information, do exercise, live your regular life, and please being kind to others, such as vulnerable population and frontline workers, something like that. Okay, that is my presentation. Thank you so much. Thank you so much for your attention. Thank you very much.
Thank you very much, Professor, for informative lecture and sharing your amazing knowledge and experiences with us. Now we have Q&A session. So this is time for you to ask any questions you have in relation to today's topic. So please use the chat function to ask questions you may have. And there will be chances to get an online gift card for those who participate in the survey after this session. So please stay tuned. 네, 교수님 유익하고 또 저희에게 도움이 되는 내용으로 강연해 주셔서 진심으로 감사드립니다. 그럼 오늘 강연에 대해 질문하실 수 있는 질의응답 시간을 갖도록 하겠는데요. 질의응답이 끝난 후에 채팅창으로 안내해드리는 설문조사에 참여하시는 분들에게는 추첨을 해서 온라인 기프트카드를 선물로 드릴 예정이니 끝까지 자리를 지켜주시면 감사하겠습니다. So we have several questions about the lecture. So the first one is, Professor, would you please be able to repeat the title of the book that describes the definition of meaning?
Man's Search for Meaning in Korean. Yeah, thank you so much, Rina Park. 죽음의 수용소에서 is correct. Man's Search for Meaning. Man's Search for Meaning.
Thank you, Professor. So Man's Search for Meaning, that's the title of the book.
So written by Dr. Viktor Frankl.
Thank you very much. Okay, so the second question is, what would be some good tips to draw the line between manageable mental stress factors versus someone who should be seeking professional help for?
Yeah, it's a very, very good question. Yeah, so if somebody has symptoms such as depression, anxiety, more than 2 weeks, it should be, I think, they should meet mental health professionals. Yeah, so 2 weeks is the critical time. Yeah, every day. I'd like to say 2 weeks is the critical time. Yeah.
Thank you very much, Professor. The third question is, in case we are in need of consulting with experts due to mental stress, how can we find a good expert fitting to specific needs we may have?
Yeah, this is a very tricky question. I think the Canadian medical system is very advanced system because when I was in Korea as a psychiatrist, I could not see patients for a long time. But here, for the first session, I usually see a patient for 76 minutes. But I know there are very lengthy waiting lists. So practically, to be honest, it is determined by your family doctor's network. But so every hospital and every university hospital have their own website, and they have very good explanation about their faculty, physicians. You can find the information about the physician's expertise. So you could ask your family doctor to refer you to that specialist, because according to Canadian medical law, so we as a physician should not refuse any referral from family doctor in Ontario. So if you could find any good doctor who is good at some specific area, please ask your family doctor to refer you to that specialist.
Thank you, Professor. The next question, I will ask questions many people may be curious about regarding today's topic. So as it is an open seminar in Canada, I wonder how Korea and Canada's post-COVID-19 coping methods, especially mental health coping methods, are different. In other words, it can also be symbolized as a different in mental health coping methods in the East and the West. So I think it's very meaningful. Is there any data that has been studied or observed?
Oh, yeah, so that's a very big question and a very important question. I know. Okay, I joined the hospital. I joined the Canadian hospital just 10 months ago. To be honest, I don't know much about the Canadian system, Canadian people, because psychiatry is very based on the culture, social system, history, environment factor. But I would say I realized that the Canadian Western system is very, very individualized system. But in Korea, in East Asia, so they have very, very collectivism. So individual approach is usually very helpful for a Canadian, but in East Asian people, I would suggest that some more I would just respect for more their privacy, because their culture is very based on the collectivism. They have kind of social phobic anxiety, something like that. Social face is so important in East Asia, in Japan, China, in Korea. So I will respect for privacy for Korean people, and for Canadian patients, I will provide more individualized planning for them to cope with COVID-19 related difficulties. I'm not sure.
Thank you, Professor, for wonderful response. Another participant asked another question saying, it goes a little away from today's topic, but would you say the post-pandemic world's approach towards the metaverse or digital connectivity help or worsen the anxiety, stress, depression, and or negative mental states of the people coming out of COVID-19?
Metaverse and digital therapeutics are very hot issue nowadays in the field of psychiatry. We don't know the exact the efficacy of metaverse or digital therapeutics, but many doctors, many physicians have a big hope. Until now, there were no serious negative result about the metaverse or digital therapeutics. So we experienced virtual connection during the pandemic. It was very helpful, although there were some side effects. But usually, in the field of psychiatry or medical field, I think metaverse and digital connectivity will be very, very useful to promote people's mental health and physical health.
Thank you very much. I will ask the last question now. Adults' mental health is also important, but I know that teenagers in particular suffered a lot of confusion as they were cut off from society, such as not being able to go to school during the COVID-19 period. What psychiatric problems did teenagers experience during COVID-19, and how do you think it could be resolved?
Yeah, it's a big question and big issue nowadays. As far as I know, Canadian government also is trying to resolve this problem. After the COVID-19 pandemic, many adolescents experience eating disorders, specifically eating disorder. Yeah, depression, anxiety were highly increased in eating disorder, in separation anxiety, and aggravation of symptom of personality disorder. So I think it is very, very, very difficult and very, very concerning situation. So we need time, and it is really, really big question. How can we resolve this problem? This cannot be done by just individual physician. I think the community, government, more higher level institute group should do some actions for resolving this problem. Education and more counseling sessions for them, individual sessions, more group sessions. Yeah, so every effort should be done very urgently.
Thank you, Professor Lee. So now we will end the Q&A session. 감사합니다, 교수님. 이제 질의응답 시간을 마무리 짓도록 하겠습니다. Thank you once again, Professor Jae-hyun Lee, for your time and very informative information. 이재현 교수님 다시 한번 시간 내어주시고 또 유익하고 유용한 내용으로 발표 나누어 주셔서 진심으로 감사합니다. So we hope you enjoyed today's seminar. There's a survey link shared in the chat room right now. So please let us know how we did tonight using the link. Selected participants will be given online gift cards. So we would very appreciate your participation. And please complete the survey through the link that we just shared on the chat. 오늘 세미나가 많은 분들에게 도움이 되셨으리라 생각합니다. 지금 대화창에 설문조사 링크를 안내해 드렸는데요. 오늘 세미나에 대한 여러분들의 의견을 알려주시면 감사하겠습니다. 설문 참여자분들 중에 추첨을 통해서 저희가 온라인 기프트 카드를 선물로 드릴 테니 여러분들의 많은 참여 부탁드립니다. Korean Consulate in Toronto is planning to organize open seminars in the near future too. So we ask for your ongoing interest and support. 주 토론토 총영사관은 앞으로도 한 캐나다 오픈 세미나를 개최할 예정이니 여러분들의 많은 관심과 참여 감사드립니다. Once again, we would really appreciate it if you can complete the survey through the link we just posted on the chat. 네, 다시 한번 저희가 지금 대화창에 올린 링크를 통해서 설문조사를 완료해 주시면 너무 감사드리겠고요. Thank you again for joining us tonight. We hope you have a great evening. 다시 한번 오늘 오픈 세미나에 참석해 주신 모든 분들께 감사드리며 쉼 있는 저녁 되시기를 바랍니다. 감사합니다. Thank you.
Thank you so much. I sincerely appreciate it. 고맙습니다.
Thank you, everyone. 감사합니다.